appropriate to address the issues that you brought up in your first presentation, and secondarily, what do you? That's the main question, and the second question is how well do the various proposals making their way through Congress now address the issues that you brought up in your first round of questions? And we're going to go in the same direction. Yeah. So we'll start again with Dr. Brown.
Obviously, my position is that we need to mandate universal coverage in order to make healthcare insurance a lower cost for each of us and our employers. Mandated coverage, I think, is part of several proposals. There are a lot of sticky details involved. I'm not suggesting anything but a mandate, and mandates always have exceptions. We have that operating currently in the automobile insurance market, so we have some experience with different options that I think we could work from. I do also believe that some sort of integrated purchase of a public purchase of from private insurers of a specific health promotion health insurance is required. And I say that because the health insurance market has spent 50 years trying to make money at a pretty high rate on every dollar that they take from us, that they take from our insurers, or our employers, excuse me, and every money that they pay to the physicians and hospitals. So every dollar that they handle, they're making money on that. They have not been responsible for developing something that adds value to the process or that adds health for you and me. So we are paying for their administrative process, but getting little out of that. And my point is, I don't believe, with 50 years of experience of watching them operate, that they can be expected to respond differently. So if we're going to have this system move towards health and health promotion, I think we're going to need a government-sponsored option. It can be purchased from the private sector. But that option has got to move us away from where we are now. And if we don't have that, I don't think it will be proposed. I'm fearful that removing pre-existing conditions will result in nothing but higher premiums, higher costs from the insurer to cover their risk, as Corey just described. I really want to focus the discussion on changing the incentives. Patients need to take more responsibility for their health and their compliance with their physician's recommended actions. We need to be incentivized to do that. There are mechanisms that can do that. Obesity is killing us all, and it will kill our children first. Primary care has to be the center point. Primary care physicians need to be trained. We need to recognize that the workforce is not in place to meet the need if we make primary care the center point. So it's going to take medical schools all over the country about 8 years to respond to any transition that we make in this direction. Just recognize that there's going to be some issues there. But if we set the incentives properly, we can, I think, begin to influence medical school students towards primary care. We've had a lot of experience with health professions, workforce policy in this country. We can make that work. Primary care and specialty care that is integrated, not separated, is the key. Right now, the system wastes a great deal. It duplicates a great deal in laboratory costs, imaging costs, and others. We cannot afford that waste, and we can eliminate that by improving the information flow and the correspondence between consulting endocrinologists and their primary care doc. We just need to straighten out the communication link. And anticipate that integration and expect it. If we don't expect it to be integrated, it won't be integrated. Because we train people in medical schools, unfortunately, to be in very thin slices. So we end up with silos that don't talk to each other. Direct-to-patient advertising for procedures.